Hi, I'm Dr. Ben Grams, and I've found that there are some people who seek out back surgery because they think it's going to cure their back pain and sciatica once and for all. And what you're about to find out is that that's not necessarily true. But before I get to that, let me be perfectly clear here. I don't think anyone really wants to have back surgery. But when it seems like surgery is your only real option for lasting relief, it's understandable why you'd seek it out. Now, when I first came across the research I'm going to share with you, I was genuinely shocked and honestly dismayed by it. Because back surgery is one of the most common surgeries performed in the United States. Get this, between the years 1993 and 2008, there was a 700% increase of surgeries performed, back surgeries, with over 1 million surgeries performed in 2012. According to international researchers, Alan Waddell, they said that the rapid expansion of disc surgery soon exposed its limitations and failures. It was accused of leaving more human wreckage in its wake more than any other operation in history. So how much human wreckage are we talking about? That's the research I want to share with you now. So in the journal Spine, 2011, they published a research study where the researchers reviewed records of 1,450 people suffering from disc degeneration, disc herniation, or radiculopathy, which is a nerve condition that causes tingling, numbness, pain, or weakness into the limbs. This is the first thing that shocked me. They found that having a spinal fusion increased the likelihood of being permanently disabled by 500%. Now, these 1,450 people, these are people whose pain was so bad that they couldn't work. So the researchers also looked at to see how many of them actually returned to work after they had a spinal fusion. What they discovered was that 74% of those who had this operation still weren't at work 2 years after. And finally, they found that a quarter of the spinal fusion patients had to have additional surgeries afterwards. Those aren't great outcomes, ladies and gentlemen. Now, that said, take it for what it's worth. I'm a chiropractor, so obviously I'm not doing back fusions day in, day out. But if you're open to an alternative, but proven approach to eliminating back pain and sciatica, this is what I'd like you to consider. So what we do is combine non-surgical treatments like spinal decompression and chiropractic adjustments, cold laser therapy, muscle release techniques, orthotics, nutrition, ultrasound, exercises, all these different elements. And then we work with you to come up with a solution that will actually improve the function of your spine. And to be frank, not just cut out the bad parts or fuse them together and hope for the best. Now, if you're wondering if this approach is even worth investigating or if it'll work for you, look, no worries. That's why I've created our good care promise, and it's good as gold, which is this. If we don't see measurable improvement by the time of your first progress evaluation, which depending on the severity of your case is usually within 2 to 4 weeks, we stop right there. So to be clear, if we don't see measurable improvement by that time frame, we're done. And so if you have back pain or sciatica and you're interested in figuring out if we can help you, just call or click right now and we'd be happy to set up an appointment with you.